kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you take in platinum medication such as warfarin, Eliquis, Xarelto, Adaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure that your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulant, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Adaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Adaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Adaxa. Your doctor who manages your platinum medication or your anticoagulant will give you complete instruction when to stop and to resume Eliquis, Xarelto, or Adaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your platinum medication, you need to discuss that with your doctor, manage your platinum medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Hello, what should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Xarelto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin or and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then need to adjust the dose and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you may need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Eliquis, Xarelto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis Geroto Obedex 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis Geroto Obedex. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your